And now it's the time to give the floor to our another partner from Bologna. Azienda USL have been a partner in the project, in our consortium. They've been the intervention site, the main intervention site in Italy. And I will pass the floor to Paola Pesci from Azienda USL of Bologna, the grant officer of our health authority. She will present the experience of Bologna during the pandemic, because as you can imagine, our hospital has been overwhelmed in terms of organizational functioning during the pandemic and during our project.
Thank you very much. Thank you, Luca, for inviting us here, to be part of this beautiful consortium. Can you? Is it clear? Yeah. Consortium. Yes, as you can see, Emiliano Bazzani is part of course, is a project leader in this context. He's the head of the prevention and security in our organization. Unfortunately, he's not able to be here because he had to go to a meeting this morning that was not possible to be postponed. So he asked to send you all the greetings, his greetings, and also from our managing director, Dr. Paolo Bordon, who is the CEO of our organization. Yes. Oh, sorry. I think I made something wrong. I just, I think I used the. Okay, I think I used this.
Yeah.
Okay. 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 Azienda USL of Bologna.
You want to use the remote control?
I think I will use this one maybe.
Okay.
But maybe. Okay.
You can also use this if you want.
Okay. USL of Bologna is, as we were saying, a partner in the consortium. Is one of the largest healthcare organizations in Italy. Covering a population of approximately 880,000 people in 45 municipalities with 9 hospitals. This is our main hospital in Bologna is called Ospedale Maggiore. And yes, we are one of the partners in this beautiful project. What we did, because of this organization has got nearly 10,000 employees, so it's a very large organization, and of course HR management is a big challenge and very critical aspect in delivering quality of care, care of good quality. So this is why we enthusiastically joined this consortium. And we thought that the approach that was designed was very important because, as Greta was saying, this idea of bottom-up approach as well, and top-down, but at the same time, bottom-up, it was interesting. It meant allowed us to make a sort of a detailed need analysis in the first part of the project. It involved about 50 healthcare workers from 3 departments. So the emergency department with 20 workers, the Department of Medicine, 16, and IRCS, Neurological Science Institute of Research, that is part of our organization, with 14 workers. And this need analysis was structured into type of 2 phases. So semi-structured interviews with the middle and senior managers, and 4 focus groups with doctors, nurses, and healthcare assistants. Detailed data analysis was performed with the help of our coordinator, Custode Pandoni and the Unipo team with our managing director and the HR department and the safety unit, but also the training. Well, many units were involved. Also the training, the units, the trade unions were involved as well in implementing the process. This is, the results of the need analysis. I find this map, the IPO map, very, very nice and interesting because, with different colors, it's quite easy to see the job resources that were in green, of course, positive team climate, professionalism, intrinsic motivation, work engagement, positive feedback from customers, of course, patients and families in our case. And of course, these were very, very good aspects to see and to read from our employees, but at the same time, of course, you can see the job demands, quite a number of red boxes that were and are still a challenge for this big organization. For example, we were saying the problem of the work-life balance was very strong, very hard at the beginning of the project, but during the pandemic, things didn't improve. So it was very challenging to try to counteract the pandemic impact with the action involved in the project, because this pandemic has hit very, very hard in all over the world. So, but other critical aspects and the job demands, probably poor communication, the workload, top-down decision making means that sometimes our employees, workers would be ready really to be a bit more empowered, to do things. I think that this kind of perception is still there, and I think we need to work on this. Probably working with our middle management and maybe also with the management board to try to identify some strategic values that we could try to implement in our organization in the future. This is the timeline. It's a bit challenging because some of it's in Italian, but I know that by now you will be quite confident with it, and also this timeline has been described before, and of course what we could see is that from the need analysis to the end of the T7 follow-up was it took about more than 2 years, and of course we implemented in our pilot site the interviews and the focus group, and so in T0 and T7, mainly distal measures were collected, and proximal measures in T1, and during all the process, during the intervention time, every 6 months, from T3 to T5, this process measures have been collected. These are the results of the T1 questionnaire, and you can see that the number of respondents was quite high, 1,551 respondents. It is true that we can see that the valid cases are not very high percentage. We know that in this kind of organizations where the time is very is not available for extra activities most of the time. We could see that maybe the employees, the respondents, sometimes were not able to complete the questionnaires, so or they didn't complete it correctly. So I think that we need to, for the future, being able to analyze a bit more the short, the problems that the workers faced. We can see that approximately 35% of the sample was between 45 and 55 years old, mostly women, 72%. That represents also it's a significant percentage for all the population in our organization. Most of them with 89% with permanent contracts, and many were professionals. In fact, about 14 leaders, managers were involved in mainly we will see later, the positive leadership intervention that took place in our organization. So this is, I find this a very, very interesting way to represent the results of 2-1. On the left side, we can see the resources, basically, what were perceived as positive from our workers. So the effort, the labor effort, the team, the support from the team, the level of satisfaction. The autonomy maybe not exactly positive. On the other side, we can see that the conflict between, in the work-life balance plays a very, very strong role. And this is this represent the 4 interventions that have been applied in our, as you all know, in our pilot site: positive stress management, positive social climate, social mapping, positive leadership development. We can see them very quickly. The positive stress management involved 78 workers, and it was meant to understand the causes and the consequences of stress and develop abilities to manage them practically, proactively. So it took about 3 months, and of course in the iGlue model, it's individual. Ooh. How did I do that? Can you hear me? No. Sorry. Oh, the battery. Oh, now it's working. Thank you. So 78 workers were involved in 8 editions and 3 group sessions of 3 hours each. All these interventions were delivered by our partner and coordinator, University of Bologna, Professor Pietro and the team, and we will see a bit later on that it was all of them were, well, most of them, because there were some problems maybe in the way we organized some of the interventions during the pandemic, but generally speaking, the interventions were very, very well appreciated by our workers. And then there is the second one, positive social climate, individual and group intervention to understand workplace conflicts, develop strategies and abilities to manage them successfully. 3 groups, 3 hours each, 7 editions and 63 workers involved between May and June 2021. The social mapping was a very well appreciated intervention and it involved 72 workers with 7 editions from May to December 2021. Of course, it's a group intervention. Probably in this case, we will see later, there was not much time to learn this kind of international intervention. It was a bit technical in a way, needed to be. So I think not all the workers, even though they could see the potential, the importance of this kind of tool, in a company like ours, in an organization like ours, where the communication is among peers, between leaders and workers at any level, with the families, is very, very, very important. And the last one, the positive leadership development intervention, that was saying that it involved 14 leaders. It was quite, I think it's quite, it's a kind of intervention that implies it's quite time consuming in a way, because it helps for 3 hours each for 3 group sessions. Greta knows very well about this, of course, and 3 individual sessions of 1 hour and a half. And of course, what I can say is that it was hugely appreciated, this. But what we need to think about is the sustainability, in the future, to allow our workers, our leaders, to benefit from this kind of. As you can see, the perception of an organizational process during the deployment of the intervention, the positive leadership intervention was very, 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 very appreciated. And generally speaking, the positive management, stress management, and the positive leadership intervention were the 2 that got the highest, level of perception. This is quite difficult slide to interpret, because it tries to compare to 1 to 7, mainly would say distal measures. And when we look at them, we could feel, not particularly satisfied, maybe. But we need to remember that, and we all know that the COVID had a huge impact worldwide. So these indicators are not just indicators, are indicators for around the world. And so we need to focus, I think, a lot on the process measure. And I think that this slide tells that something important, that the perception of intervention, the way they were delivered, very professionally delivered, were extremely appreciated by our workers. So what we intend to do is to try to design an exploitation plan that will maximize the benefit of the results of this beautiful project. And so we see this as a sort of a new beginning in a way. So thank you very much. And